7 common digestive disorders you need to know about. If you have pain in your abdomen or intestines, you may have one of the common digestive disorders. Welcome to Heath Place. Please subscribe and the notification bell to receive more health tips videos. Most people don't like to talk about it when they are experiencing stomach disorders, but having a condition is common. There's no need to suffer in silence. There are effective treatments for the most prevalent digestive conditions. If you suspect you have any of the digestive disorders, don't delay in speaking with a healthcare professional. Here are 7 common digestive disorders you need to know about. Number 1. Gastroesophageal reflux disease, GERD. When stomach acid backs up into your esophagus, a condition called acid reflux, you may feel a burning pain in the middle of your chest. While it's common for people to experience acid reflux and heartburn once in a while, having symptoms that affect your daily life or occur at least twice each week could be a sign of GERD. According to the National Institute of Diabetes and Digestive and Kidney Diseases, GERD affects 20% of Americans. If you experience persistent heartburn, bad breath, tooth erosion, nausea, pain in your chest or upper part of your abdomen, or have trouble swallowing or breathing, please see your doctor as these could be an indication of GERD. Most people find relief by avoiding the foods and beverages that trigger their symptoms. Also, over-the-counter antacids or other medication that reduces stomach acid production and inflammation of the esophagus can also be an alternative. In addition, lifestyle changes like elevating the head of the bed, not lying down after a meal, avoiding tight-fitting clothing, and quitting smoking can also help. However, some cases of GERD require stronger treatment, such as medication or surgery. Number 2. Gallstones. Gallstones are hard deposits that form in your gallbladder. A small, pear-shaped sac that stores and secretes bile for digestion. Every year, nearly 1 million Americans develop gallstones. Gallstones form as a result of too much cholesterol or waste in your bile, or if your gallbladder doesn't empty properly. When gallstones block the ducts leading from your gallbladder to your intestines, they can cause sharp pain in your upper right abdomen. Medication sometimes dissolves gallstones, but if that doesn't work, the next step is surgery to remove the gallbladder. Number 3. Celiac disease. About 1% of the American population has celiac disease. Unfortunately, more than 80% of people with celiac disease don't know they have it or have been misdiagnosed with a different condition. Celiac disease is a serious sensitivity to gluten, which is a protein found in wheat, rye, and barley. Eat gluten, and your immune system goes on the attack. It damages your villi, the finger-like protrusions in your small intestines that help you absorb nutrients from the foods you eat. In children, symptoms may include abdominal pain and bloating, diarrhea, constipation, vomiting, and weight loss. Symptoms in adults can also include anemia, fatigue, bone loss, depression, and seizures. Yet some people may not have any symptoms. The only treatment for celiac disease is to completely avoid eating gluten. Common alternatives to gluten include brown rice, quinoa, lentils, soy flour, corn flour, and amaranth. Number 4. Crohn's disease. Crohn's disease is part of a group of digestive conditions called inflammatory bowel disease, IBD. Crohn's can affect any part of the GI tract but most commonly affects the terminal ileum, which connects the end of the small bowel and the beginning of the colon. The causes of the disease are not certain yet, but it is believed to be connected to genetics and family history. Its common symptoms are abdominal pain, diarrhea, rectal bleeding, weight loss, and fever. Treatment depends on the symptoms and can include topical pain relievers, immunosuppressant, and surgery. Avoiding trigger foods like dairy products, carbonated beverages, alcohol, coffee, raw fruit and vegetables, red meat, and foods that are fatty, fried, spicy, or gas-producing can also help prevent flares. Number 5. Ulcerative colitis. Ulcerative colitis is another inflammatory bowel disease that may affect as many as over 800,000 Americans. The symptoms of ulcerative colitis are very similar to those of Crohn's, but the part of the digestive tract affected is solely the large intestine. If your immune system mistakes food or other materials for invaders, sores or ulcers develop in the colon's lining. If you experience frequent and urgent bowel movements, pain with diarrhea, blood in your stool, or abdominal cramps, kindly inform your doctor. Medication can suppress the inflammation, and eliminating foods that cause discomfort may help as well. In severe cases, treatment for ulcerative colitis may involve surgery to remove the colon. Number 6. Irritable bowel syndrome, IBS. If your digestive tract is irritable or you experience stomach pain or discomfort at least 3 times a month or more, then it could be irritable bowel syndrome, IBS, another common digestive condition. About 10 to 15% of the world's population suffers from IBS, out of which 45 million persons live in the United States. Signs of IBS can vary widely from having hard, dry stools one day to loose, watery stools on another. Bloating is also a symptom of IBS. Although the causes of IBS are unknown, the treatment of symptoms centers largely on diet, such as eating low-fat, high-fiber meals and avoiding common trigger foods, such as dairy products, alcohol, caffeine, artificial sweeteners, and foods that produce gas. Additionally, friendly bacteria, such as the probiotics found in live yogurt, may help you feel better. Because stress can trigger IBS symptoms, some people find cognitive behavioral therapy or low-dose antidepressants to be useful treatments as well. Number 7. Anal fissure. Anal fissures are tiny, oval-shaped tears in the lining of the very end of your digestive tract called your anus. The symptoms are bleeding and pain after moving your bowels. Straining and hard bowel movements can cause fissures, but so can soft stools and diarrhea. A high-fiber diet that makes your stool well-formed and bulky is often the best treatment for this common digestive condition. Medication to relax the anal sphincter muscles, as well as topical anesthetics and sit baths, can relieve pain. However, chronic fissures may require surgery of the anal sphincter muscle. Lastly, in case you experience any of the symptoms mentioned in this video so far, don't hesitate to visit your doctor.